Hey there, health enthusiasts. In today's video, we're diving deep into the incredible health benefits of ashwagandha, an ancient herb that has been used for thousands of years in Ayurvedic medicine. We'll explore how this small evergreen shrub, native to India and parts of Africa, can help reduce stress and anxiety, improve sleep quality, enhance physical performance and strength, support reproductive health, and even boost cognitive function. So, buckle up and get ready to discover the power of ashwagandha. Let's start with one of the most well-known benefits of ashwagandha: stress and anxiety reduction. A systematic review by Pratt and colleagues in 2014, published in the Journal of Alternative and Complementary Medicine, analyzed 7 studies, including 5 randomized controlled trials. They found that ashwagandha significantly reduced stress and anxiety scores compared to placebo. Pretty impressive, right? In a more recent study by Lepresti and team in 2019, published in the Journal of Ethnopharmacology, 60 stressed but otherwise healthy adults received either 240 milligrams of ashwagandha extract or a placebo daily for 60 days. The ashwagandha group not only experienced significant reductions in perceived stress, anxiety, and depression scores, but also had lower cortisol levels, a stress hormone, at the end of the study period. Another randomized, double-blind, placebo-controlled study by Chandra Sekhar and colleagues in 2012, published in the Indian Journal of Psychological Medicine, investigated the safety and efficacy of a high-concentration, full-spectrum ashwagandha root extract in reducing stress and anxiety in adults. The study involved 64 subjects with a history of chronic stress, who received either 300 milligrams of ashwagandha or placebo twice daily for 60 days. The ashwagandha group showed significant improvements in all stress assessment scales and had substantially reduced serum cortisol levels compared to the placebo group. So how does ashwagandha work its magic on stress and anxiety? It may regulate the hypothalamic pituitary adrenal axis, which plays a crucial role in the body's stress response. Ashwagandha may also have GABA mimetic effects, promoting relaxation and reducing anxiety, as suggested by Lepresti and colleagues in their 2019 study. Now, let's talk dosage. In the studies we discussed, the dosages of ashwagandha extract ranged from 240 milligrams to 600 milligrams per day, with treatment durations of 60 days. These dosages were well tolerated and found to be effective in reducing stress and anxiety. However, it's essential to consult a healthcare professional before starting any new supplement regimen, as individual needs may vary. Moving on to sleep quality, several studies have investigated the potential of ashwagandha to improve sleep and alleviate insomnia symptoms. A double-blind, randomized, placebo-controlled study by Langard and colleagues in 2019, published in the journal Cureus, evaluated the efficacy and safety of ashwagandha root extract in insomnia and anxiety. The study involved 60 participants who received either 300 milligrams of ashwagandha or placebo twice daily for 10 weeks. The ashwagandha group experienced significant improvements in sleep quality, sleep onset latency, total sleep time, and reduced anxiety levels compared to the placebo group. In another study by Salve and team in 2019, published in the journal Sleep Medicine, 50 adults with insomnia received either 300 milligrams of ashwagandha root extract or placebo twice daily for 8 weeks. The ashwagandha group showed significant improvements in sleep quality, sleep efficiency, and total sleep time compared to the placebo group, with no reported adverse effects. A meta-analysis by Chia and colleagues in 2021, published in the journal PLOS One, reviewed 5 randomized controlled trials investigating the effect of ashwagandha on sleep. The analysis concluded that ashwagandha had a small but significant positive effect on sleep quality, sleep onset latency, total sleep time, and sleep efficiency, with a more pronounced effect in individuals with insomnia. Ashwagandha's sleep-promoting effects may involve its ability to regulate neurotransmitters such as serotonin and GABA, which play a role in sleep regulation, as suggested by Langard and colleagues in their 2019 study. Additionally, ashwagandha's stress-reducing properties may contribute to improved sleep quality, as stress and anxiety are common causes of sleep disturbances. In terms of dosage, the studies mentioned used ashwagandha root extract dosages ranging from 300 mg to 600 mg per day, divided into 2 doses for 8 to 10 weeks. These dosages were found to be safe and effective in improving sleep quality and reducing insomnia symptoms. If you're struggling with sleep issues, incorporating ashwagandha into your sleep hygiene routine may be beneficial. Taking ashwagandha supplements about an hour before bedtime may help promote relaxation and improve sleep quality. However, always consult a healthcare professional before starting any new supplement, especially if you have underlying health conditions or are taking medications. Now, let's shift gears and talk about ashwagandha's potential to enhance physical performance and strength. A meta-analysis by Bonilla and colleagues in 2021, published in the Journal of Functional Morphology and Kinesiology, reviewed 12 randomized controlled trials investigating the effects of ashwagandha on physical performance. The analysis found that ashwagandha supplementation significantly improved maximum oxygen consumption, VO2 max, and strength compared to placebo. In a randomized, double-blind, placebo-controlled study by Wankhede and team in 2015, published in the Journal of the International Society of Sports Nutrition, 57 young male subjects with little experience in resistance training received either 300 mg of ashwagandha root extract or placebo twice daily for 8 weeks, along with a resistance training program. The ashwagandha group experienced significant increases in muscle strength and size, reduced body fat percentage, and increased testosterone levels compared to the placebo group. Ashwagandha's performance-enhancing effects may involve its ability to increase muscle mass and strength by promoting anabolism and reducing catabolism, as suggested by Wankhede and colleagues in their 2015 study. Ashwagandha may also improve endurance by increasing the body's resistance to stress and fatigue. The dosages used in these studies ranged from 300 mg to 600 mg per day of ashwagandha root extract, divided into 2 doses for 8 to 12 weeks. These dosages were well tolerated and found to be effective in enhancing physical performance and strength. If you're an athlete or fitness enthusiast looking to improve your performance, incorporating ashwagandha into your training regimen may be beneficial. However, always consult a healthcare professional before starting any new supplement, especially if you have underlying health conditions or are taking medications. Remember, ashwagandha should be used in conjunction with a well-designed training program and a balanced diet for optimal results. Moving on to reproductive health, ashwagandha has been traditionally used to support both men and women. Modern research has begun to investigate the potential benefits of ashwagandha in this context. In a pilot study by Dong Gray and colleagues in 2015, published in Biomed Research International, 50 healthy women received either 300 mg of ashwagandha root extract or placebo twice daily for 8 weeks. The ashwagandha group experienced significant improvements in arousal, lubrication, orgasm, and satisfaction compared to the placebo group, suggesting that ashwagandha may be beneficial for improving sexual function in women. Several studies have also investigated the effects of ashwagandha on male fertility. In a study by Gupta and team in 2013, published in Evidence-Based Complementary and Alternative Medicine, 46 male patients with oligospermia received either 675 mg of ashwagandha root extract or placebo daily for 90 days. The ashwagandha group had significant improvements in sperm concentration, motility, and morphology compared to the placebo group. Another study by Mahdi and colleagues in 2009, published in the journal Fertility and Sterility, investigated the effects of ashwagandha on semen quality in infertile men. The study involved 60 infertile men who received either 5 grams of ashwagandha powder or placebo daily for 3 months. The ashwagandha group had significant improvements in sperm concentration, motility and morphology compared to the placebo group. Ashwagandha's effects on reproductive health may involve its ability to regulate hormone levels, such as testosterone and luteinizing hormone, which play crucial roles in reproductive function, as suggested by Lopresti and colleagues in their 2019 study and Wankhead and team in their 2015 study. Ashwagandha may also have antioxidant properties that protect sperm from oxidative stress-induced damage. The studies mentioned used varying dosages of ashwagandha, ranging from 300 milligrams to 5 grams per day for 8 to 12 weeks. These dosages were found to be effective in improving sexual function in women and semen quality in infertile men. If you're seeking to support your reproductive health, incorporating ashwagandha into your wellness routine may be beneficial. However, always consult a healthcare professional before starting any new supplement, especially if you have underlying health conditions or are taking medications. It's important to note that ashwagandha should not be used as a substitute for medical treatment in cases of infertility or sexual dysfunction. Now, let's talk about ashwagandha's potential to improve cognitive function and protect against age-related cognitive decline. A randomized, double-blind, placebo-controlled study by Choudhury and colleagues in 2017, published in the Journal of Dietary Supplements, investigated the efficacy and safety of ashwagandha root extract in improving memory and cognitive function in adults with mild cognitive impairment. The study involved 50 participants who received either 300 milligrams of ashwagandha or placebo twice daily for 8 weeks. The ashwagandha group showed significant improvements in immediate and general memory, executive function, sustained attention, and information processing speed compared to the placebo group. Another study by Pingali and team in 2014, published in Pharmacognosy Research, evaluated the effect of ashwagandha on cognitive and psychomotor performance in healthy adult volunteers. The study involved 20 participants who received either 250 milligrams of ashwagandha extract or placebo twice daily for 14 days. The ashwagandha group showed significant improvements in reaction time, card sorting, and choice discrimination tests compared to the placebo group. A systematic review by Eng and colleagues in 2021, published in the Journal of Ethnopharmacology, analysed the clinical use of ashwagandha to ameliorate cognitive dysfunction. The review included 5 randomized controlled trials and found that ashwagandha significantly improved memory, attention, and information processing speed in healthy adults and those with mild cognitive impairment. The review also highlighted ashwagandha's potential neuroprotective properties, which may be relevant in the context of neurodegenerative diseases such as Alzheimer's and Parkinson's. Ashwagandha's cognitive-enhancing effects may involve its ability to reduce oxidative stress, inflammation, and the accumulation of beta-amyloid plaques in the brain, which are associated with age-related cognitive decline and neurodegenerative diseases, as suggested by Ning and colleagues in their 2021 review. Ashwagandha may also modulate the cholinergic system, which plays a crucial role in learning and memory. The studies mentioned used ashwagandha dosages ranging from 250 milligrams to 600 milligrams per day, divided into 2 doses for 2 to 8 weeks. These dosages were found to be safe and effective in improving cognitive function in healthy adults and those with mild cognitive impairment. If you're seeking to support your cognitive health, incorporating ashwagandha into your wellness routine may be beneficial. However, always consult a healthcare professional before starting any new supplement, especially if you have underlying health conditions or are taking medications. Remember, ashwagandha should be used in conjunction with a healthy lifestyle, including a balanced diet, regular exercise, and mental stimulation for optimal cognitive health. In addition to the benefits we've discussed, ashwagandha has also been investigated for its potential anti-diabetic effects and ability to regulate blood sugar levels. A study by Andalu and Radhika in 2000, published in the Indian Journal of Experimental Biology, found that ashwagandha root powder, when given to type 2 diabetes patients for 30 days, significantly reduced blood glucose levels, HbA1c, and serum insulin levels compared to the control group. A systematic review and meta-analysis by Derg and colleagues in 2020, published in the Journal of Ethnopharmacology, analysed the effects of ashwagandha on diabetes mellitus. The review included 24 studies, 5 human and 19 animal studies, and found that ashwagandha significantly reduced fasting blood glucose, postprandial blood glucose, and HbA1c levels in both human and animal studies. The review suggests that ashwagandha may be a useful adjuvant therapy for managing diabetes mellitus. Ashwagandha has also been studied for its potential anti-inflammatory and pain-relieving properties. A randomized, double-blind, placebo-controlled study by Ramakanth and team in 2016, published in the Journal of Ayurveda and Integrative Medicine, investigated the efficacy and tolerability of ashwagandha in patients with knee joint pain and discomfort. The study involved 60 participants who received either 125 milligrams of ashwagandha extract or placebo twice daily for 12 weeks. The ashwagandha group experienced significant reductions in knee pain, stiffness, and disability compared to the placebo group. The potential mechanisms behind ashwagandha's anti-inflammatory and analgesic effects may involve its ability to inhibit the production of pro-inflammatory cytokines and modulate the NF-κB signaling pathway, which plays a key role in the inflammatory response, as suggested by Ramakanth and colleagues in their 2016 study. Ashwagandha has also been investigated for its potential anti-cancer properties, primarily in animal and in vitro studies. These studies suggest that ashwagandha may have anti-proliferative, anti-metastatic, and chemoprotective effects against various types of cancer, including breast, lung, colon, and prostate cancer, as reported by Dutta and colleagues in 2019 in the journal Frontiers in Pharmacology and RAI, and team in 2016 in the journal PLOS One. However, it's essential to note that the evidence for ashwagandha's anti-cancer properties is primarily based on preclinical studies, and more human clinical trials are needed to confirm these effects. Additionally, ashwagandha should not be used as a substitute for conventional cancer treatment, and individuals with cancer should consult their healthcare provider before using ashwagandha or any other herbal supplement. While the current research on ashwagandha's health benefits is promising, there are limitations to the available evidence. Many studies have small sample sizes, short durations, and varying dosages and formulations of ashwagandha, making it difficult to draw definitive conclusions. Additionally, most studies have been conducted on specific populations, such as individuals with stress, insomnia, or cognitive impairment, and the results may not be generalizable to the broader population. Future research should focus on conducting larger, well-designed, randomized controlled trials with standardized ashwagandha formulations and dosages to better understand its effects on various health outcomes. Long-term studies are also needed to assess the safety and efficacy of ashwagandha over extended periods. Now let's talk about safety and side effects. Ashwagandha is generally considered safe when consumed in recommended doses for up to 3 months. However, some individuals may experience side effects such as nausea, diarrhea, drowsiness, and headache, as reported by Pratt and colleagues in their 2014 review. In rare cases, ashwagandha may cause liver injury, particularly when consumed in high doses or for prolonged periods, as noted by Phillips and team in a 2019 case report published in the Journal of Clinical and Experimental Hepatology. Certain populations should exercise caution when using ashwagandha or avoid it altogether. Pregnant women should not consume ashwagandha as it may cause miscarriage or premature labor, as mentioned by Pratt and colleagues in their 2014 review. Individuals with autoimmune disorders, such as rheumatoid arthritis, lupus, or multiple sclerosis, should consult their healthcare provider before using ashwagandha, as it may stimulate the immune system and worsen their condition, as cautioned by Pratt and team in their 2014 review. Ashwagandha may also interact with certain medications, such as sedatives. thyroid hormone medications, and immunosuppressants, as noted by Pratt and colleagues in their 2014 review. Individuals taking any medications should consult their healthcare provider before using ashwagandha to avoid potential interactions. The typical dosage of ashwagandha used in clinical studies ranges from 250 milligrams to 600 milligrams per day, usually divided into 2 doses, as seen in the studies by Lopresti and colleagues in 2019 and Salvi and team in 2019. However, some studies have used higher dosages, up to 1